welcome to this special interview on Al Arabiya News. I'm Joanne Saria. Today, we're shedding light on critical issues that affect millions of women across the Middle East and beyond. From war-torn areas to more stable nations, women's sexual and reproductive health remains a pressing challenge. We'll explore the impacts of conflict, poverty, and cultural taboos, and discuss the importance of comprehensive sexual education, particularly for youth in the Arab region. We'll also look at how health awareness and attitudes have evolved over the years and what steps are being taken to address the needs of women in low literacy communities. To further discuss these topics, I'm joined by Laila Baker, the Regional Director for Arab States in the UNFPA. Laila, thank you so much for joining us today.
Thanks for having me.
Thank you. Let's start with the ongoing conflicts in the region. You've witnessed everything firsthand, all the challenges there. What are the most pressing health challenges women are facing in war-torn areas like Gaza and Sudan, and how are you addressing them?
Thank you very much for the question, because I find that all too often, women's health and women in general are the first things that are dispensed when something goes wrong. In times of stability, UNFPA works very hard to build up resilient healthcare systems, the workforce that'll help bring reproductive and sexual health to women wherever they may be. And it works very well. So family planning, lots of comprehensive sexual education, a lot that we do on safe motherhood, birth, postnatal care. But the minute conflict strikes, something changes, both in the dynamics of the communities that we work in, and certainly the safety and security elements that are there. So if you ask me about what the most pressing issues are, of course, there's the life-saving element. Imagine that you're a woman who is one of many, almost 2 million who've been displaced in Gaza. No home, no water, no fuel, a very fragile shelter, and you're pregnant. Now, what should be one of the most precious, joyous moments of your life, albeit something that's filled with anxiety, a normal kind, is now fraught with uncertainty about your own life, that of your unborn child, and your entire family. So one of the most pressing issues that we have is the continuation of access to health care. And in the case of Sudan, Yemen, Palestine, the health systems have been so destroyed. The infrastructure has been so heavily attacked, and the healthcare workforce is also killed, both deliberately and as collateral damage to the war, that we no longer have access. Even if you could get to a facility, accessing that care becomes almost impossible. So for a woman in that position, the physician who has to treat her without medication, in cases of cesarean sections also with limited access to anesthetic, you can imagine what kinds of issues that she may face. And UNFPA works to provide emergency care in all of those situations. We bring in people, surgeons, midwives, doctors. We work with all the partners on the ground. We try and provide hygiene products for women and girls who are menstruating, where there's no access to clean water. And we stay and we deliver even when the bombs are falling on our own heads, even when UN staff are being killed. We never leave anyone behind. And first and foremost, that means the women and girls in crisis.
And in terms of delivering this aid to the women and girls in these areas, we know Gaza, aid has been blocked from entering the Strip. How has your organization been getting around this?
Well, getting around it is really the term. Let's start where we really need to put the emphasis, though. Aid workers and the aid infrastructure and the civilian infrastructure of any territory and country, including in Gaza, needs to be protected. It's not just about getting humanitarian. We have turned what is fundamentally a political attack on the people of Gaza and the Palestinian population into a humanitarian crisis by allowing it to continually to be attacked so brutally. It is on the member states to put a halt to that. Once that is achieved and you have a permanent ceasefire that respects international humanitarian law and the lives of the population of the Palestinians residing in the Gaza Strip, then unhindered aid needs to flow, and the protection of the aid workers as well as those of the civilians that they deliver to. If I tell you in Gaza that we've had nearly 300 UN staff members who've already been killed, that's unacceptable. And it continues on where Israel finds impunity in those actions. That has to come to a halt. All parties to the conflict need to come to the table and resolve it. And where women and girls are concerned, they need to be given priority. So UNFPA makes for sure that in any aid that does get in, reproductive health care supplies are delivered. Our partners on the ground work hand in hand with the community there, and they themselves have been displaced. So prioritization of women, prioritization of the goods that they need, and making for sure that we can continue to advocate for that wherever they may be.
Okay. What are the long-term consequences or impact of these challenges, not only on women, but on families and even entire communities?
I think we haven't seen that. The conflicts are still ongoing and raging in Sudan, Yemen, Palestine, and many other places around the region. I can only tell you what we know from empirical evidence from other places, because until there's permanent peace and until you can get people back on their feet and look at not only the physical consequences of death, morbidity, but also the psychological impact. We don't know what it's going to be like after you've been under siege for 16 months. We don't know what it's like for the children who are going to grow up orphans and have seen their parents brutally killed. But you can imagine from what we have from evidence in other places, and unfortunately, humans don't learn from their prior mistakes, that there will be long-term consequences on the psychological impact, and probably on the fertility as well of women and girls, even the intent to engage and give birth if it's been so traumatic. I can only speculate at this point, but none of that will be good. It will be on the international community, UNFPA, amongst the main partners in that, to ensure whatever we can do to help women and girls and their families and their communities access that care, to make it available once it's safe enough for us to deliver.
Okay. What about women's health in, say, more stable countries, but with still a very high poverty rate? For example, Jordan or Egypt. What are the challenges that you're seeing there?
That's an excellent question, and thank you so much for asking it. Because the one big challenge that we have globally, where women and girls are concerned from a gender perspective, is inequality. You're already at the losing end of the spectrum if you're born a girl in many of our countries. Taboos, social, cultural norms that don't allow for women to have free mobility. At 12, when you hit puberty, a boy's world opens up. He becomes much more active. He's seen as a young man. He's given privilege and access to the world. And the young woman's world starts to shrink and become much more domestic. So with UNFPA, we focus a lot on a few things. Other than the aspects that I mentioned to you about having healthcare that's part and parcel of the systems, not as a peripheral service that's provided, but really one of the fundamental aspects of healthcare delivery, making for sure that it's budgeted for in the national budgets and revenues also contributing to that. We start young. Sexual and reproductive health and information around your own body and your decision-making allows you also the critical thinking and information that you can make good life choices. When to get married, how to choose a partner, how many children to have. That allows you to exercise your own freedom, but also consider your community and your nation at large. And so we think these are the elements that we like to look at over the long term. In the short term, we also try and provide an injection of cash voucher assistance to some of the poorer women to allow them to access. We provide care that's free of charge. And we provide mobile services in many of those communities that you mentioned. But the focus really is on ensuring that everyone has access to free and informed choice. People do things for a reason. And so if you want to really tackle poverty, you have to hit it at the reasons why people are impoverished, because they've been marginalized, and the inequality that leads to that. That's what we do at UNFPA.
Laila, you mentioned education. Let's talk a little bit about comprehensive sexual education. This may be a bit of a taboo subject even in the West, so not just here in the Middle East. What does sexual health education entail, and why is it crucial for the youth in the Arab region?
Well, I think comprehensive sexual education is important for everyone. And I think we've made it taboo. Part of it is because it's so mysterious and it's considered such a private subject. But we are all products of reproduction and sexual relations. Understanding that process and being able to have the information that allows you to choose well when you have children, who you will engage with, and to be able to protect yourself from being exploited as well, is some of the things that we really think are important. And it also links to some of the national priorities. I think all too often we think of it only through the lens of sexuality and the taboo of the norms. But think about population growth and distribution. If you understand that the choices that you make as an individual on who and how many children to have and when, then you'll understand also what your contribution as a citizen or a member of that society means. And hopefully you'll make choices that are good for you as well as for your community and your nation, rather than it being an imposition of a policy on how many children to have. You allow for people to access the information that allows them to make a responsible choice. That's what we focus on.
So how do you navigate cultural sensitivities to effectively deliver this knowledge in diverse communities?
You embrace it. You understand what are the norms first, because I don't think that there's a lot of projection, in my opinion. I don't think any society is homogenous, even in a single country. And so understanding the local communities, we do a lot with local communities, and not imposing a single format. Where you try and understand what are the things that the community wants, where they see sexual education or reproductive health education, or even the services that they provide, as something meaningful to them, rather than an objective that we come in with. And we work with local partners on the ground. We work with the women and girls themselves. And we work with community leaders, religious leaders, to understand also if we need to tailor some of the messages, or how we would work with them. And so it allows for much greater two-way communication, where we also learn from the community about what we need to adjust. And it feels much more tailored to not only their needs, but also their aspirations for what they would like as individuals or a nation.
What about low literacy areas? What methods are being used to educate women in these low literacy areas in the region about sexual health and just women's health in general?
Yeah. It's funny that you ask that. I mean, UNFPA doesn't engage in literacy programs per se. That's not our area of expertise. But literacy as we know it, to be able to read and write, is certainly important. And we try and work with our partners to lower the literacy rate. Equally important is understanding what sort of intuitive knowledge and experiential knowledge that the women who have not had access to, schooling per se, formal schooling. There's an enormous amount of intuitive, intergenerational knowledge that's passed down. Some of it is quite correct. Much of it is tied to social norms and behaviors. And so working with the women in the community to understand what drives their desires, their aspirations, and linking it back to the programs that we have, either in reinforcing some of the positive norms, but also correcting some of the misinformation. And then using even the women who are illiterate to speak to other women and encourage people to become literate. Because it has to be a two-way conversation. And I think one of the things that I love most about UNFPA is the fact that it isn't we don't see ourselves as the giver, and there's someone else who's the receiving at the end. It's a conversation where it's constantly evolving in the direction of what can we learn from the community and how can women and girls be agents of their own change, and where we just facilitate that conversation.
And over time, say the past couple of decades, how have attitudes towards sexual and reproductive health evolved in the Arab region?
Kind of a tricky question because, again, it's not homogenous. In 2024, UNFPA did a very large formal review with the governments on some key indicators around sexual and reproductive health, population, and development, because they're intrinsically linked. And we found overall that there was progress on a lot of the indicators. Maternal health, for example, is doing better now than we did 30 years ago or 40 years ago. The fertility rate is dropping as well. So people are having fewer children, they're investing more in their children. And overall, people live longer. But those are aggregate figures. And it's the inequality that hits at the hardest and at the heart of the matter. If nations are only looking at the aggregate data, then you tell the wrong story. And I think if I look overall, there's a lot of progress, particularly on the health side. There's a lot more awareness about how to protect from gender-based violence and a lot more receptiveness even to engage in it at the service level. But what we haven't been able to really hit at is how to reduce the gap between the haves and the have-nots. And I fear that if we don't keep a stronger eye on that, that we will start to see regression in the next decade around even some of the positive indicators.
Okay. And what are the UNFPA's key priorities for advancing women's sexual health and education in the coming years?
Our priorities always remain the same. If we had it our way, there would be zero gender-based violence in the world. No woman would ever have to be subjected to that. There would be zero preventable maternal death. So no woman should die giving life, bringing life into this world. And we want zero unmet need for family planning. So if you want to plan your family correctly, you need the right information, the right access to service, the right planning methods, and the ability to make your choice. So whether that's the health systems or the legislative procedures that support it or the community mechanisms, the taboos, we work across the board on that. So we want 3 zeros. No one to suffer at the hands of gender-based violence, no one to die bringing life into this world, and no one to not be able to have the choice on when and how many they would have in their family. We want to have people exercise that choice freely.
And in terms of delivering that information and education for individuals or families or women or even young girls, what methods are you using now as things have developed? There's technology, social media. What methods are being used?
It's not just about information, by the way, also, although I'm glad you raised that issue. Education and information is only one part of it. But think about the times that you've had information about something but not been able to access it for one reason or another. So we're very careful, one, about being seen as the provider of the most accurate information. So if you go to our website, we can guarantee that the information there is 100% true on where services are, on the information that you can get around menstruation, around hygiene, around safe delivery, around prevention of gender-based violence, including sexual violence. So we are the source of that true information. And through all of our media channels, our website, social media, we try and get the word out. The second is that we also try and have a conversation, if you will. So what's hindering people from being able to use that information properly? Is it the fact that there are social norms? Do we need to work with the community? How should we do that with our partners, with local people, religious leaders? Or is it that we have legislation that prevents it? And this has been a big one over time where governments come and go. Even the country where I'm a citizen and grew up in the United States has changed fundamentally over the years, depending on who's in power. and shifts and sways. So UNFPA tries to also work with the media, the mainstream media, not only and we really appreciate the time that you have. This is one of the ways that we're very happy to engage, is that if we are the source of that information, how can we use the media also to get the message out and then get feedback so that we can work at the individual level all the way up to the nation?
Laila,
it's very difficult.
Yeah, Laila, just one more question regarding gender-based violence. You did mention that, and I want to talk about that a little bit. How have things changed over the years? So there's the female genital mutilation, child marriage. How have things changed and evolved over the past few years?
There's so many forms of gender-based violence. And fundamentally, like what we were talking about, poverty, inequality is the big piece that we need to tackle. If women are always seen that they are less than everyone else in their society, if young girls are also seen even at a lower rung, they're to be seen but not heard, and that they do not have agency over their own choices that they make, to go to school, on the literacy piece that you talked about, on being able to pursue a career, on being able to have a work-life balance, who to marry, when to marry, how many children to have, then you can see where the layers of gender-based violence and some of the issues that you raised, particularly around child marriage, are problematic. But then again, we don't label them because people do what they do for reasons that may not be known to us. And if I, as a parent, no one wants to see their child harmed. No one wants to see anything but good. And every parent who does what they do, whether that's the female genital mutilation or early marriage, fundamentally, we believe has the best interest of their child. What we try to do is ask, how do you see that? If you had the choice to break the social norms that force you into choosing female genital mutilation, if those weren't there, would you still practice? And everyone says no. So then we say, how are we going to change the social norms around that? What do we need to do to work hand in hand with you? And similarly, child marriage. Now, child marriage and all of these are very complicated in times of poverty, in times of economic decline and crisis, because they are also intrinsically tied to livelihoods. So we work with our partners to ensure that people who are perpetuating these norms or perpetuating these behaviors, which we would like to reduce, that we try and find a way that they have an alternative mechanism for their livelihoods rather than having to rely on them. It's not very easy.
Laila Baker, thank you so much for your time.
Thank you also. I wish you well.
Thank you.